Hi, my name is Dr. Thuy Vazquez, and I'm from Palm Harbor Premier Dental. And I know there's a lot of questions regarding dental implants, and I'm here to answer any questions that you have. Dental implants it's an artificial tooth root that is implanted into your bone. And that gives you an option for any kind of replacement for an extraction or a tooth that is gone bad. So the condition for us is an option when you want to replace an area of a missing tooth, and for chewing function, for oral hygiene, for comfortness, and just for you to talk instead of wearing a little piece of something that is artificial that you can take in and out. The advantages for implant is definitely function is my first. You can chew, you can talk, you can floss between the teeth, you can keep everything clean, so you can have like just a normal functionality. The process of getting whether you're a possibility for getting implants is first we need a comprehensive exam. Okay, that is all the x-rays, doctor exam. Secondly is looking at your med history. We want to make sure that we take into consideration if you have diabetes, heart condition, periodontal disease, which is a gum disease, so that we can make sure that once we place the implant, you have it for a long time, for the rest of your life. So the first step is definitely make sure you have bone. Okay, once we know that you have bone, we would first flap some of the gum. So because we treasure those gum. The gum area is what makes you look like a tooth that comes out. So we would place the implant in. We would definitely place it in a symmetrical way so that if we put back the teeth, that the force the bone area can take that. So once that's placed, we wait for 3 months for the bone to integrate to the implant. Once the integration occurs, after 3 months, then we put the neck. The neck looks like the tooth is coming out of your gum area, and then we put the artificial tooth on top. And that's the process for the implant. So bone grafting is a very important process that is needed when you remove a tooth. Imagine when you move a tooth, you have a really deep hole. It's like a well. And it takes years for your bone to kind of creates its own bone and put it back in that hole. And it takes too long for the process to do that. So we would put cadaver bone back into that well, and we would level it so that your body will regenerate much faster when something is impregnated inside that. And also sometimes we put bone when we put implants where you're missing like a little piece of area. We can use bone to regrow in that area. So you would have 2 options. First is the removal. Removable meaning something that you have to take it out at night. You have to clean it, then in the morning you have to put it back in your mouth. So, and then the other is fixed. Fixed is something that you don't remove at all. Then you'll just have like your regular teeth. You floss, you clean, and you don't have to worry about it popping out. And when you talk, you chew. So those are the 2 differences. I mean, removable, it's all on preference, but a lot of my patients would like the fixed option so that they have that confidence of speaking and not have to remove it out clean out once you eat. So those are kind of the 2 options that you have. Most of my patients recover within 2 days. Just a little soreness, and that's pretty much it. There's no longevity of pain or anything like that. Dental implants last as long as you have your teeth. It's like treat it as a tooth that is yours. Once it's being placed, once it's restored, take care of it like you own teeth. So if you take care of your teeth, you can have it as long as it's able to. That's pretty much it. Dental implants cannot have cavities because it's an artificial tooth, but it can have what we call implantitis. Implantitis is an inflammation of the gums around the implant. So implants are, like I said, treated as your tooth. You have to floss, so you have to make sure you brush in the gum area. And if you do that, you won't have to worry about implantitis. There is definitely financing at our office. We definitely have financing options. We have multiple options because we want to make sure that we take care of your health. That's the most important part. And in regards to insurance now, a lot of insurance do pay a little portion of implants. So please, look into your insurance plan. If you are considering implants, look into that. But they do have a lot of options now. We have options to help you go through this process and give you an option that you're happy with. All right, so I hope that I'm able to answer all your questions. Please give us a call, or I'm here at the Palmer Premier Dental, and give us a call if you have any other questions that you want to ask me regarding dental implants. I'm here to answer your questions.